Ms. Parker, what is the North Carolina School Community Health Alliance, and how do school health centers promote particularly adolescent health?
Actually, Betsy, the Alliance is representing the school-based and school-linked health centers in North Carolina, and I know probably a lot of the viewers and some of the folks who work actually with public health aren't that familiar with school-based and school-linked health centers, but they are actually providers. They are part of the safety net, meaning that they are the ones who are there for kids who don't have any insurance or have not the right kind of insurance, or perhaps have lost insurance, especially now because of the loss of employment and loss of private insurance along the way. So these are actually doctor's offices in the schools or little community health centers that deal mostly right now with only adolescents, that actually give an opportunity for access to health care for those kids who really need it. We have 55 in North Carolina, and actually they serve a lot more than just 55 schools. They're, some of the ones that are there actually represent more than one school, and we also have mobile units that we count as one center, but they will serve more than one school. And we have school link centers that actually serve a region, so they're serving multiple schools at one time. They actually are more than just the school nurse, because a lot of people think that school health services are the school nurse. We work collaboratively with the school nurses, and we actually provide the access to care to a real provider who can make a diagnosis and give treatment and work with the family to do the kinds of things that are needed. And I think the beauty of school health centers, especially in North Carolina or across the country, and there are about 2,000 across the country, is that we look at comprehensive health care. And now that we're talking about integrated mental health a lot across the state and across the country, we, from the very beginning, integrated mental health or behavioral health, which is really one of the major problems I think that adolescents face. We've always integrated that care into the care that we provide in our school-based health centers. So we are 55 strong right now, hoping to be more, and we provide the access to care for adolescents, mostly adolescents in North Carolina, because that was how they were created. But we do have some in the elementary schools as well, and more communities are looking for them.